me is Seema. We are two experts with Baby Chakra, and we are here live asking, understanding your queries, and we will be answering your questions, which you feel that you can generously open with us. Two experts on board and two solutions. Isn't that amazing, Seema? What's your take on this?
Absolutely amazing. Hi, everybody. This is Seema Bhatia, a health and wellness author at Baby Chakra. So, not from a medical background exactly, but yes, coming up with a lot of home remedies, some tried and tested, some with a scientific background. So, we are here to help you in all the minor queries that you have, minor, major, irrespective, whatever it is. So, you might just open up and let us know what are your questions. So, Dr. Pooja, so you take up the first question.
Yeah, I just received a question that it's saying that my she's a mom to be, and she has a placenta on the posterior end. Her delivery date is coming to be near, but she is a little worried whether the placenta position would be changing or not. So, how would you like to address this query to her?
Okay, a change in a position is not really commendable even on the medical grounds, but there are particular precautions that she has to take, which is complete bed rest, which is advised by most of the doctors when you have a low lying placenta. It's also known as placenta previa, which is a low lying placenta or a posterior placenta when you have which is attached to the uteral wall on the back side.
Okay,
That's what a posterior placenta means, when your placenta is attached on the back side of the uterus,
okay,
backward. So in that case, you need a complete bed rest. That is for sure. Along with that, you have to avoid bending, any physical trauma, any jerks to your belly, which can affect or can lead to bleeding in worse situation if the trauma is very harsh.
right,
That is my recommendation. Along with that, you can start with healthy diet, your vitamins, and few of the doctors also give pregnancy support injections, which are hormonal injections, if needed, to manage the situation.
okay. So, are these injections really compulsory?
No, they're not. It depends, completely depends on your health. It completely depends how the placenta is placed, how low lying it is it covering your cervix. It all depends on that.
Okay. Thank you for letting me know. Now, I have another question which I would like to ask that, my baby is around 2.5 months old, and he has been coughing very, very badly. So, what is a home remedy can I give to this?
Okay, cough with babies. Generally, the mothers avoid medication, which is very common. But
Yes.
breastfeeding, of course, as being a lactation expert, you might have a special comment on that. That breastfeeding is one of the most important thing to continue with, especially when you're ill, because it has so much antibodies, antioxidant properties, nutrients, which help to build immunity. I'm sure you are the best person to give a light on that.
I agree. I agree. Onto it, breastfeeding. When your baby is coughing, we can understand the choking could happen because of air going inside, or the latch position is not proper, or even if due to the season change from
Yeah.
the transition, extra dry heat is coming in. That could also cause. Also, we can understand if the AC is too strong, or if the cooler air is what is causing the trouble. Cough could be a part for the child, but evaluation is something which is important. So whether the latch is not proper, or if cough is accompanied with fever and cold, or if the child is gasping, if the milk is coming too much and the child's mouth area is small, so the holding capacity is small, that could also cause a choking problem, which might come into cough. At night times there is dryness in the air, so that can also lead to a little coughing while breathing. So I think that these all points can be evaluated and help a child to feel better if patted on the back, if taken up in a burping position, if help to move around in the room. So this is how I feel that it can be taken up. This is my
To
take.
add on to this, one of the major thing that mothers tend to avoid is dehydration. Dehydration, when their mouth gets dried, they tend to cough, which is very common also. So dehydration can also lead to a bit of coughing when their mouth dries up, when their throat dries up. They tend to cough at times. So that is
Right.
also one aspect, to look into.
Right. So another question that I have is, there is a mom to be. She's newly diagnosed into pregnancy, and she's 6 weeks. Okay, her gestational age is 6 weeks, and she has spotting.
Okay.
So she is a little worried, and she doesn't have a deep understanding of whether this is normal or whether this needs to be, taken into with a serious effort. So, how are we supposed to, address this?
Okay. When it comes to spotting and discharge, it's very common to worry, especially during pregnancy. So, spotting when you have on initial early days of your pregnancy, it could be an implantation bleeding, in which you have 2 to 3 drops which you see, which is actually known as spotting. But
Okay,
besides that, along with spotting, if you have a stomach cramp or you have severe abdominal pain, a pelvic pain, vomiting, nausea, dizziness, that is not normal. If
okay,
you have any co-symptoms related to spotting or along with spotting, or your spotting is changing into a foul smell, or
haha,
have excessive bleeding, that is absolutely not normal. In
oh,
that case, you need to go get a checkup done if there is a foul smell coming out, or else you see a clot, or else
okay,
it turns into heavy bleeding. These are not normal. Such
okay.
discharge spottings are absolutely not normal, and they need to be addressed. And the clarity should be taken from a doctor whether it's due to some interinfection or a bleeding.
So, do you think that the mother should wait for some time, or should immediately address her problem? What do
So
you?
if the spotting continues, what it's believed, like if the spotting continues like for an entire day, you see it in a particular like higher frequency.
Right.
आधे आधे घंटे पे हो रहा है, 5-5 मिनट में हो रहा है. That is not normal.
Okay, that's not normal. Fine,
No,
fine.
that is like internal bleeding that you might be getting, due to which you have to actually consult a doctor, get it checked, to make sure that there is no infection or it's no implantation bleeding or the placenta has not detached from the uterus. That could
Yes,
be a possibility of the bleeding.
definitely, definitely. So I have a next question that a mom has asked. She has a serious concern, and the baby's weight is not gaining.
Okay.
Okay. Now we do not know the basic weight, that what the birth weight was or what the actual weight is right now. But what I believe is that if the child's activities are, the child is very active, has around 10 plus hours of sleep,
Hmm.
considering that the child is within 0 to 18 months of age. Okay, is introduced to all major food groups like vegetables, pulses, fruits,
Right.
okay, in a natural form, and sometimes non-veg, then definitely weight gain can happen in an equal pattern. Okay, some
Okay.
recipes which you are sharing, even if the mom takes care of that, she introduces scrambled eggs, or your amazing recipe of potato and eggs, or beetroot broccoli
Hmm.
soup, that
Right.
is something which is very innovative, and if the mother tries, I am 100% sure that weight gain is going to happen. But what would be your take onto this?
So scientifically, if you check on the weight gain of a baby, it's always compared to your birth weight. So
Yes.
it has actually, it's a percentile chart. I'm not gonna get into the scientific background of it, but you have to compare always your birth weight to your present weight to know the growth of the baby, which is very important. As per lactation and weight gain is concerned, I'm sure you can highlight on that again.
Yes.
So I guess you can continue for that.
So, feeding can be continued till the age of 2 years by the WHO guidelines, but definitely after the age of 6 months, there is a trend which is observed, that once the complementary feeding, or once we start giving foods to the baby, there is a trend that baby's activeness increases, baby's taste buds start showing some effect, a positive effect, and a behavioral effect of having tantrums. So, a mix and match of both. And yes, as the age progresses, the child becomes more demanding on a specific kind of food. So, if the mother addresses the issue and continues breastfeeding, definitely weight gain is going to happen, considering the child is in an active state of mind.
Right. And to
Right.
add on to it, you don't have to necessarily leave breastfeeding even if the
Yes.
breast milk continues. As mentioned by Pooja, that I share recipes on my profile, which is I have profiled a few of the recipes using breast milk, which is also very healthy. It's not necessary once your baby is like about a year or a two, then you stop breastfeeding. You can introduce fruits mixed with breast milk, which is also a very healthy option, so that they get the goodness of both.
Absolutely. Moving on to it, we have another question that the mother has asked that 10 years of age gap between pregnancy, is it safe? Now, well, as a mother, I feel that this is a big age gap. But yes, if you are really looking forward that, your child requires a sibling, that is definitely a personal decision with considering your spouse. And for yourself, I would say it's a good decision because your body is in a manner of getting into pregnancy and you're planning everything. That is all a positive mindset.
Right.
Only consider your age. If you are below 35, it will be a very healthy pregnancy. Above 35 is also absolutely a healthy pregnancy, but there could be some deviations because of the age factor, not because of your, it's particularly you or you being an individual or something that would have happened into your previous pregnancy. Do not compare both your pregnancies
Right.
because that is a very different journey.
Hmm.
So that is my take onto it. Seema, over to
So
you.
having an age gap between two kids is absolutely fine. But as mentioned, the age of the mother does make a lot of difference, which is if you're 35 and above, your risk factor increases. You cannot consider your pregnancy, which was in your 20s, to be the same as what you have in 30s. Your fertility decreases over the age. You take longer to conceive, of course. Additionally, your risk factor for gestational diabetes, preeclampsia, high blood pressure, premature delivery, all of this increases. So you have to be more careful. It's no problem to have a 10 years gap, or 12 years gap. It's completely on you. But as per your own health, of course, you have to be more considerate, because if you have pregnancy in your later stage, your fertility would be a bit lower than what it was previously, and your risk factors increase, which you have to be very careful about.
Definitely. And to add on to it, if natural conceiving is not possible after such a long
Hmm.
age gap, then there are techniques of IVF or test tube
Right.
babies or getting yourself treated into a fertility clinic.
Right.
But those, these all techniques are very, very beneficial and would have some side effect because nothing is, as crystal clear.
Right. Right.
So definitely treatment is something which many people take care and it has become very common. It is affordable. Okay. We should consider the best viable option. We should not get depressed. We should not lose hope. And we should not even be worried or stressed that this is not happening. It will happen, but when it's due course of time.
True that.
Right? Okay, so we move on to the next question by our mothers. Okay, she's saying that in pregnancy, my skin is becoming very dull. I'm low on energy, and I am almost 4 to 5 months pregnant. Dryness, itchiness is something which is really very, you know, a problem for my skin.
Hmm.
So, in summers, what solution could you give me?
Okay. So first thing is to hydrate yourself, which is very necessary. If your skin is not healthy from the inside, you cannot expect that any cream, any solution will work on your skin, which is very
Okay.
important. Have vitamin rich food, which is good for you. Spinach, eggs, nuts, seeds. These are all rich with antioxidants. They have healing property. They heal your skin from the inside. Turmeric, it's an excellent ingredient to use, and it's found in like everyday foods. It's very common to find it at home. Turmeric with milk, turmeric face pack. Use turmeric as much as possible, because it's a great ingredient which heals your skin from the inside as well as the outside. As pertaining to dryness, you of course have to moisturize your skin well, which is you can use natural products as compared to the one which are chemical based, which in the long run will ultimately damage your skin. I would always prefer using a natural product over something which is using some chemicals inside, because you will not find it harmful right now. You might have good results out of it, but over the long run some chemicals do have an effect on certain skin, which can damage your skin more when you're aging. So prefer natural products.
Absolutely. So, as you rightly said, that hydration is one of the important keys. Taking natural products is one of the important things. Organic foods is something which which helps us to build upon a natural skin. And as you said, that turmeric, I would add up besan, curd. These are these are things which are available inside our home. They are on the shelf, but it's only that we don't have to. हमको वहां से निकालना है और उसका इस्तेमाल करना है.
Yeah.
सेकेंड थिंग इज कोई भी फ्रूट्स सीजनल फ्रूट्स है अभी मैंगोज आ रहे हैं दैट ऑल्सो हेल्प्स टू गेट द स्पार्क ऑन द स्किन
Yes.
आंवला है सिट्रस फ्रूट्स है अगर हम ये रोज खाते हैं तो डेफिनेटली इसका बहुत ज़्यादा फायदा होता है बिकॉज फ्रूट्स में एंटीऑक्सीडेंट्स होते हैं जो हमारे स्किन के ब्लेमिशेस को एकदम रिजुविनेट करते हैं सो अंदर से ताजगी जो हमारे चेहरे पे आनी चाहिए वो चमक आनी चाहिए डेफिनेटली ये
True
फ्रूट्स
that.
के थ्रू आती है Okay, that was nice. Moving to our next question, a mother is very concerned that her child is not able to, pass stools on a regular basis. She's saying that she's breastfed her child and the child is 3.5 months old. But the passing of the motions is all after 5 to 6 days. So यहाँ पे शी इज अ लिटिल वर्ried थोड़े थॉट्स उनके जिटरी हो गए हैं नर्वसनेस है कि बेबी को क्या हो गया है व्हाट वुड यू से
Okay. So it could be, maybe, the baby is not feeding enough. Maybe it's breastfeeding a multiple times in the day, but not getting enough milk. That could be one of the possibility. Or secondly, he's having dehydration from the inside, because of which the digestion is being compromised, because of which the passing of the stool, the gut flora is not developed properly. It's being hampered because of the digestive problem, and the baby is not passing stool. That could be two of the possibilities. Of course, an evaluation from the doctor is always recommended. आप एक बार डॉक्टर को जाके दिखाइए, देखिए क्या प्रॉब्लम है. इफ द बेबी इज पासिंग गैस, baby is not having stool, it's definitely related to digestive problem. Maybe the gut flora is not functioning properly, or it's not developed, because it's a baby, it's very common.
करेक्ट
So it's better to see a pediatrician once, and get it evaluated, instead of just worrying about it. It's okay even if you harass the pediatrician 3 to 4 times. I'm sure he's not gonna bother.
नो डेफिनेटली द डॉक्टर्स हमेशा कंसर्न दिखाते हैं अगर कोई प्रॉब्लम है बच्चे को डेफिनेटली उनके पास जाना बहुत ज़्यादा ज़रूरी है
True.
ओके आर नेक्स्ट क्वेश्चन इज कि बाय द यूजर की मेरी बेटी 8 साल की है और उसका वजन सिर्फ 21 किलो है बट शी इज़ वेरी एक्टिव तो
Okay.
इसके लिए हमें क्या मतलब क्या सुझाव देना चाहिए फ्रॉम सीमा's पर्सपेक्टिव हम लोग पहले शुरुआत करते हैं एंड देन आई विल कम टू माय इनपुट्स
Okay, I would suggest you start first, because I've been talking from so long. People are not listening to you.
ठीक है सो मॉम जो बहुत ही ज्यादा वरिड है आई थिंक 8 साल की बच्ची अगर बहुत ज्यादा एक्टिव है और 21 उसका वजन है प्रेजेंट वजन है तो वरी करने की बात नहीं है प्रॉबेबली उसका इनटेक बहुत ज़्यादा होगा लेकिन वो उसके शरीर पे दिखाई नहीं दे रहा होगा अगर वो खेल कूद में अच्छी है पढ़ाई करने में अच्छी है तो हम उस और वो अच्छे रूप से ले रही है तो हम यहाँ पे ध्यान दे सकते हैं कि हम लोग खाने की क्वांटिटी बढ़ा दें फर्स्ट अगर वो 1 चपाती खाती है या 1.5 चपाती खाती है तो आधी चपाती लंच में आधी चपाती डिनर में सब्जी की क्वांटिटी बढ़ा दे और इसके साथ साथ प्रोटीन्स की मात्रा भी पनीर दही या फिर दाल वेजिटेबल दाल है इसके रूप में बढ़ा दे वीकली वंस या वीकली ट्वाइस हम लोग स्प्राउट्स दे सकते हैं जिसके कारण उसका वजन बढ़ने में आसान हो जाएगा खाने में घी जरूर डालिएगा दैट इज ऑल्सो वेरी वेरी इंपॉर्टेंट और नींबू छिड़कना सब्जी पे या सैलेड पे अनिवार्य है क्योंकि इससे विटामिन और मिनरल्स का अब्जॉर्प्शन है जो हमारे मैक्रो न्यूट्रिएंट्स रहते हैं जैसे कि प्रोटीन्स कार्बोहाइड्रेट्स और फैट्स उसके लिए हेल्पफुल रहते हैं सो दिस इज वन पार्ट ऑफ इट. ऐसा कहा जाता है कि हम लोगों को ब्रेकफास्ट स्किप नहीं करना चाहिए, और एज अ न्यूट्रिशनिस्ट मैं हमेशा कहती हूँ कि फर्स्ट मील ऑफ द डे शुड बी लाइक अ किंग. ओके, ये कहावत भी है. सो
True.
हमेशा ब्रेकफास्ट ताज़ा अच्छा होना चाहिए. कॉर्नफ्लेक्स, ओट्स, दीज आर ऑल सीरियल ऑप्शंस. लेकिन अगर आपकी बेटी रोटी सब्जी खाना पसंद करती है, या कभी इडली डोसा, या कभी पराठे, वो खा के अगर स्कूल को जाती है, तो डेफिनेटली उसका दिन अच्छा जाएगा, उसकी स्फूर्ति बनी रहेगी, और उसकी आने के बाद, घर पे आने के बाद उसकी जो भूख है वो भी बढ़ती जाएगी. आपको उसके हैबिट्स में चेंज नज़र आ जाएगा, और उसका एक्टिवनेस और बढ़ेगा. इसके कारण धीरे 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 उसका वजन जो है वो बढ़ता नजर आएगा. सो मेक वट एवर इज एडिक्वेट फॉर हर. लेकिन घर के खाने पे फोकस कीजिए. प्रोसेस फूड को थोड़ा सा दूर रखिए, एंड यू विल सी वंडरफुल चेंजेस हेल्पिंग योर चाइल्ड टू गेन वेट. सीमा.
True. So as you said, protein-rich food is one of the basic when you're trying to gain weight or you want to gain healthy weight. I'm not saying by weight gain you don't need to increase your cholesterol, sugar, वो सब increase करने की जरूरत नहीं है. The problem is healthy weight gain here. So add protein-rich foods. Add egg in the breakfast, which is very healthy. One of the most healthiest nutrient-rich food in which the baby will feel like the daughter will feel full in the entire day. Yet she will have the adequate amount of minerals, nutrients which is required. Add fruits, dry fruits in your breakfast, which is also very important. Having a date in the morning along with the breakfast is very, very important. It has amazing properties. It helps you, boost immunity, your weight, increase nutrient level in your body. It's an amazing dry fruit to have. Dates is very important. Khajur. Secondly, in your meals, balance your meal. Include salad, soups, dal. Have a balanced meal. सिर्फ एक खिचड़ी खा के पेट भरेगा नहीं. Put vegetables in it. Have dal, have roti, everything. Having a balanced meal is very, very important when you're trying to gain weight, which is a healthy weight. Follow
एब्सोल्युटली.
that. Also try taking her for walks. Walking, exercising सिर्फ पतले होने के लिए नहीं है. Even when you're trying to gain muscle weight or your healthy weight, it's very important to exercise. I'm not asking you to weight lift, but हाँ, walk के लिए लेके जाना, jogging के लिए लेके जाना, it's always preferable. You can take her for that also. That will definitely help.
एंड दैट विल डेफिनेटली हेल्प यू ऑल्सो, बिकॉज आपका मदर डॉटर का जो बॉन्ड है वो डेफिनेटली अच्छा रहेगा. इवन यू विल बी मोर एक्टिव कि कि मेरी बेटी एक्सरसाइज करिए. she will be an example for the family. So the entire family starts working out, and it will be a very beautiful bond. if अगर आप एक कॉमन थ्रेड पे कनेक्ट होते हो, तो चिंता करने की कोई बात नहीं है, ना कोई गुंजाइश रहती है. ओके, नाउ वी हैव अ नेक्स्ट क्वेश्चन फ्रॉम अ यूजर कि डज पॉजिटिव ब्लड ग्रुप एंड नेगेटिव ब्लड ग्रुप अफेक्ट प्रेगनेंसी. सो सीमा, what would be your take on to it?
So there is this medical condition which happens when the mother is negative blood group, negative RH, and the father is positive. There could be a chance of a complication in birth, which is very common. So in this, what happens is since your blood group, आपका अगर blood group negative है, अगर positive antibody आपके blood में mix होते हैं, तो complications बढ़ते हैं. So it's not a problem to everybody. सबके साथ ये नहीं होता. But yes, you have to be careful. Make sure you are evaluating this blood group factor always before planning a pregnancy. ये सिर्फ
Okay.
तभी होता है जब महिला नेगेटिव ब्लड ग्रुप की होती है और मेल इज पॉजिटिव ब्लड ग्रुप.
एंड इसमें हम लोगों को ये देखना है कि अगर महिला नेगेटिव ब्लड ग्रुप में है और मेल पॉजिटिव में है, और अगर फीटस पॉजिटिव है, तो महिला को इंजेक्शंस लेने पड़ते हैं कि डिलीवरी सेफ हो जाए. कॉम्प्लिकेशंस क्या होते हैं कि ये डॉक्टर आपको ज़्यादा बेहतर समझ पाएंगे, बट इन्फेक्शन सीरियसनेस कोई बात नहीं है. इट इज़ जस्ट दैट ये ब्लड ग्रुप एक रेयर होता है. उसके लिए डॉक्टर आपको इत्तला करते हैं कि ब्लड बैंक से ब्लड रेडी रखिए. अगर ऑपरेशन आपको पता है कि सेक्शन होने वाला है, ऑपरेशन की संभावना पहले से ही तय है, तो उस वक्त आपको दिक्कत नहीं आनी चाहिए, भाग दौड़ नहीं होनी चाहिए, उसके लिए सावधानी बरतें. बट डिलीवरी सेफ होती है, बच्चा हेल्दी होता है, माँ तंदुरुस्त होती है. ऑपरेशन के बाद थोड़ी कमजोरी डेफिनेटली आती है, पर सब अच्छा होता है, एंड दिस हेल्प्स टू हैव अ बैलेंस एंड अ हेल्दी लाइफस्टाइल आगे जाके भी। सेकेंड प्रेगनेंसी में भी सावधानी इतनी ही होती है कि अगर फिर भी फादर इज पॉजिटिव एंड मदर इज नेगेटिव, द मदर हैज टू टेक दोज इंजेक्शंस again, so that the baby is brought healthy in this world. So this
Yes.
is how we would like to sum it up in this answering this question. Okay, now there is a last question which I would like we that we can take it up. I want to know that I am suffering about. I want to know about me, whether I am suffering from dust allergy. One thing, and if yes, what should I do? So we take it into two aspects. She's asking how do I know that I'm suffering from dust allergy, and if yes, what are the steps we should take in order to protect ourselves.
Right. So to answer this question, first thing to do is know your triggers. अगर डस्टिंग के टाइम पे अगर हो रहा है, फ्रीक्वेंटली हो रहा है, एक दो बार इज फाइन, सबको खांसी आना डस्टिंग के टाइम पे इट्स वेरी नॉर्मल. बट इफ यू आर गेटिंग सीवियर कॉफ, डिफिकल्टी इन ब्रीदिंग, सीवियर सिम्टम्स अगर आ रहे हैं every time when you know around the dust or pollution, then that could be a problem. The easiest way to evaluate is to get an allergy test done. You can
Okay.
find it in any hospital and clinic. It's a simple test. It's a blood test rather, in which allergy parameters are evaluated based on आपको कब कब खांसी आई या सिम्टम्स हुए. यू कैन इवेल्युएट 10 पैरामीटर कर सकते हो, 20 पैरामीटर कर सकते हो, अकॉर्डिंग टू आप पूरे दिन में क्या करते हो और कब आपको खांसी आई. सो डॉक्टर विल इवेल्युएट कि कौन से सिचुएशंस पे आपको खांसी या कोई सिम्टम्स दिखे, और वो प्रोबेबल सिचुएशन पे एलर्जी टेस्ट होती है. इट्स अ वेरी सिंपल ब्लड टेस्ट.
Right, absolutely. What Seema suggested is doing a blood test is very nice, but we also have to understand कि अगर डस्ट एलर्जी है उसके साथ कोई associated symptom तो नहीं, इचिंग है, रैशेस है, कुछ सूजन है. ओके, दीज आर ऑल्सो एसोसिएटेड सिम्टम्स. सिर्फ डस्ट एलर्जी से नहीं होता है, इट कुड बी पोलन एलर्जी, इट कुड बी अ ट्रिगरिंग फैक्टर. बहुत ज्यादा आप साफ सफाई का काम एक साथ कर रहे हो और आपको कभी आदत ही नहीं हुई है, मास्क नहीं लगाया है, कपड़े से चेहरा नहीं ढका है और आपने तुरंत सब शुरू कर दिया, डेफिनेटली वो आपके बॉडी पे एक इफेक्ट करेगा और उसका इफेक्ट जो है 2-3 दिन तक रह सकता है. सो प्रोबेबिलिटी इज दैट you take precaution when you know that you have allergy. While traveling you take precaution, while going out you cover yourself. कोविड है, कोविड था, पैंडेमिक खत्म हो रहा है, people have stopped using mask, but you know that once you step out of the house you might get it, so you can just cover yourself with a mask. That is one thing. Second thing is sanitize, use a sanitizer wherever you are going. So probabilities we can prevent rather than getting into a hazardous steps and anticipating that things could worsen. सो दिस इज व्हाट आई फील कि प्रिवेंशन इज बेटर देन क्योर. और अगर आपको कंफर्मेशन के लिए चाहिए तो डेफिनेटली जैसे सीमा जी ने कहा है कि आप लैब में जाके ब्लड टेस्ट करवा दो, ताकि वो आपका जो आंसर है वो बहुत ही स्टैंडर्ड तरीके से आपको मिल जाएगा. और उसके लिए सोल्यूशन यही है कि प्रोटेक्शन करना बहुत ज़्यादा ज़रूरी है.
And you also have medications for the same. अगर एक particular allergy होती है, you definitely have medications to cure it or manage it as per कौन सी degree का allergy है आपको. So it's very easy. There's nothing to worry. Even if you have severe symptoms due to some allergy, just go to the doctor, just do a blood test, get it confirmed, and get it treated. Don't prolong it.
Absolutely. So I think this was a very nice session that we had. We both enjoyed give answering your queries. Okay. So these were the questions which you posted up live right now and we have taken it up. And we both have made an attempt and made sure that you are very, very satisfied in receiving the answers. I hope you have enjoyed it. Please give us your reviews. Your comments will help us to help you better in understanding how can we make this on a regular basis. Seema, your take on it?
Sure, I totally agree to it. It was a very informative session. I'm sure काफी सारे users को अपने questions के answer मिले हैं. For more questions, for more answers, आप पूजा को reach out कर सकते हो, मुझे reach out कर सकते हो. For recipes, tips, advices, हम लोग दोनों हैं बेबी चक्रा के ऐप पे. You can come down to us, ask us whatever you want. I'm sure.
Definitely. Thank you, Seema, for your time, valuable time. And thank you. It was very, very nice for having this interactive session. And I hope our users have enjoyed it. So,
Same. Thank you, Pooja. Thank you, all the
signing off
users.
for the
Stay
day.
connected.
Yes, stay connected.